You've seen them. Someone lies on a table, the chiropractor twists their neck and crack. Instant relief, instant satisfaction, and millions of views. But here's the real question. Do these crack videos actually help people, or do they just look cool on camera? I'm Amin Ebrahimi, I'm a physical therapist, and today we're breaking down the science behind it. I'll show you what actually works long term, not just for the camera, but for your real spine, your real pain, and your real life. Even people with no back pain love these videos. Why? 1. The sound. The pop sound is addictive. It's like bubble wrap for your brain. 2. The instant reaction. People stand up like, bro, I feel 10 years younger. This creates a reward loop for viewers. 3. The illusion of fixing the root cause. It looks like one magical crack resets the whole spine, but we'll get into why that's not the whole story. But what actually makes a crack sound? No, your bones aren't smashing together. The crack is called cavitation. A joint gets stretched quickly, pressure changes, gas bubbles inside the joint fluid collapse, and pop. You hear the sound. The sound does not mean the joint is fixed. It's simply pressure release, like opening a soda can. Cracking doesn't realign bones. Your spine is in the Jenga tower. The relief is real, but here's why. 1. Neurological reset. Your nervous system gets a shock, reducing pain temporarily. 2. Muscle relaxation. The sudden movement can switch off tight muscles. 3. Endorphin release. Feel-good chemicals. Same effect as a stretching or massage. 4. Placebo effect. Expectation plays a huge role, but here's the key. The relief is temporary for most people. As a physical therapist, I'll be honest, spinal manipulation can help the right patient, useful for acute low back pain, facet joint stiffness, some types of neck pain, temporary muscle guarding, and people who feel stuck or locked. Benefits: quick pain reduction, increased mobility, reduced muscle tension, and psychological release, feeling like something changed. It works best when combined with strength training, mobility work, patient education, and home exercises. Chiropractic alone equals short-term. Chiropractic plus rehab equals long-term results. And the cons, when crack videos became misleading. 1. It looks like a miracle quick fix. Pain doesn't come from one root, so it won't disappear in one crack. 2. It encourages people to chase the sound. Some patients become addicted to the pop. 3. It can create fear. People think their spine is out of place and needs constant realignment. This is 100% false. 4. Some videos exaggerate or stage reactions. The dramatic screams, "Oh my god, my soul left my body." These are not real clinical outcomes. And now the risks nobody mentions. Spinal manipulation is generally safe in trained hands, but it's not risk-free. Low back risks include irritated nerves, temporary increased pain, and muscle spasm. Neck manipulation risks, rare but serious. Arterial dissection, dizziness, and headaches. This is why screening is everything. Not everyone should be cracked, even if it gets views. And when chiropractic cracking is not a good idea. Avoid manipulation if you have severe osteoporosis, rheumatoid arthritis, neurological symptoms, numbness or tingling down both sides, recent trauma, history of a spinal surgery, suspicion of disc herniation causing severe pain, vascular issues, and extreme hypermobility. For these cases, controlled physio-based rehab is much safer. What actually works long-term instead of cracking? If you want real, lasting results, you need 1. Stabilization training, deep core activation, TA breathing, multifidus training, dead bugs, bird dogs. This keeps your spine stable. 2. Mobility work, gentle daily motion, cat-cow, hip flexor stretches, thoracic rotations, hamstring mobility, and pelvic tilts. Mobility equals youth for the spine. 3. Strength training. A strong spine doesn't need constant cracking. Focus on glutes, hamstrings, core, mid-back muscles, and posterior chain. 4. Posture habits. Move often, sit less, walk daily. 5. Education. Understanding your pain reduces fear, and fear fuels pain. So, do crack videos actually help? Here's the truth. They help temporarily for the right person. They don't fix long-term dysfunction. They can be part of treatment, but never the whole treatment. They're great for views, but not a plan for life. Cracking gives a moment of relief. Rehab gives years of freedom. Chiropractic cracking videos are satisfying, entertaining, and sometimes genuinely helpful. But they are not magic. Your spine doesn't need constant cracking. It needs control, strength, mobility, and the right habits. If you want real results, combine hands-on care with a smart rehab. I'm Amin Ebrahimi, your physical therapist. If you enjoyed this video, please hit like, subscribe, and share it with someone who might benefit from this video. And see you in the next video.